Hey guys, Curtis Alexander. Can garlic help lower your blood pressure? Let's talk about that. The first thing to know about garlic, it contains a compound called gamma glutamyl cysteine. And basically, what that is, it's a precursor to allicin. And if you've read anything about garlic before, allicin is kind of the magic ingredient in garlic. So when you chew or you crush, or even if you cut a clove of garlic, you get allicin. Allicin can help widen those blood vessels. It has been shown to remove plaque from arteries. It's also been shown to decrease cholesterol. What else does it do? It's a precursor to glutathione. Glutathione is your master antioxidant. And finally, it is a natural ACE inhibitor. And if you're not aware, ACE inhibitors are one of the main classes of prescription blood pressure medications that are used most commonly by doctors. So definitely some good things going on with garlic from that front. Now, as far as the proof, has there been any research? And pretty consistently, what we find is a lot of these studies involved people that had wide ranges of blood pressure. But if we focus more on the hypertensive, the people with the highest blood pressure, we generally can see a consistent drop. So the systolic is your top number and the blood pressure, diastolic's the bottom. We can see a drop in the systolic number of 7 to 9 millimeters of mercury and diastolic 4 to 6. So it's a fairly decent drop that we're seeing in the studies. Now, the thing to point out in the studies, they weren't using raw garlic. They were using garlic supplements. I'll talk about that in 1 minute. But that doesn't mean raw garlic can't be helpful. What they have done with raw garlic is they've shown that, say, if somebody consumes, say, a clove twice a day of raw garlic, which not everybody's going to be up for doing that, but they have shown that it can lower your chances of getting to those very early stages of blood pressure. But mainly we're looking at garlic supplements when it comes to lowering blood pressure. What about dosing? The problem with the studies, the dosing range has been super wide. So we've got studies doing 300 milligrams a day all the way up to 7,200 milligrams a day. They do that in divided doses. So if if I were to start, I would probably go in the range of 500 to 1,500 milligrams a day. I would again divide that dose into 2 to 3 doses per day. And I would look for an allicin content anywhere from 1.1 to 1.3%. Most of your reputable supplements are going to have that allicin concentration on there. I'll put a link to a couple products in the description that I would feel comfortable recommending that do that. But again, start at the little bit of the lower end, kind of work in that range. Again, do it divided doses. The other thing I want to point out, and I catch grief for this on the videos when I say, you do want to talk to your doctor, talk to your pharmacist, and people give me grief about that. But in this case, it's very much true, because if you're already on blood pressure lowering medications and you add in garlic supplements, there are drug interactions, there are drops in blood pressure that we could see that would maybe be problematic. So just let your doctor know that you're thinking about doing this. Have your pharmacist run an interaction check. So let me know in the comments, guys. Have you taken garlic for blood pressure? Was it helpful? Did you get side effects? Those sorts of things are great to know. Also, go to the link in the description if you want 11 other natural therapies that I personally use, recommend, that I've seen results with. Go get that, see how many of them you know about and that you're actually using right now. It's a free checklist. Just drop your email, I'll send that to you. So hope that was helpful, guys. I will see you in the next one. Thank you.